Sir, we are live now. With all your permission, sir, I will be starting this session.
Yes.
Good afternoon, everyone present here. I welcome all the participants on today's session. Let's welcome today's speaker, Doctor, with great honor, Dr. Bhushan S. Bhalgat, sir. Sir has done MCH, Surgical Oncology, and Consultant Surgical Oncologist at Shayadri Hospital, Pune. Today, sir is going to discuss on a topic, tobacco health hazards. Let me tell you overview of the topic. Tobacco is one of the most leading cause of preventable illness, disability, and death worldwide. It is responsible for many health hazards and associated with numerous chronic diseases such as cancer, cardiovascular disease, respiratory disease, etc. To know more about this topic, I would like to invite sir and hand over this session to sir. Over to you, sir. Kindly proceed from here.
Thank you, Faraz. Thank you, Med Talks, for giving me this opportunity. So today the topic is very important, and the topic is related to tobacco. India is considered as the tobacco capital of the world. It is both due to smoking and chewing tobacco, and the hazards are many, innumerous. The patients which come to us, we see very unfortunate patients who are struggling to get treatment because the treatment options are very less for tobacco related diseases, and the treatment options for the cancers which are occurring due to tobacco, they are also limited because the number of patients are so much that the waiting list for the treatment is also long. So let us talk about this very important topic, tobacco and its health hazards. So we would be going through 6 sections throughout the PowerPoint presentation. First of all, we would see what are the health hazards of tobacco in general, followed by which types of tobacco are there and how tobacco can be ingested in the body. Thirdly, we would talk about the cancers which are related to tobacco. Myself being an oncosurgeon or a cancer specialist, I would specifically focus on the cancers which are related on through tobacco. The prevention methods, how we can avoid this tobacco and how we can avoid the tobacco related hazards. Later on, we would talk about the treatment options for cancers occurring due to tobacco. And the lastly, I would show some slides which are related to my YouTube channel related for cancer related diseases. So one by one, let us start. Before starting, see this is not a fun fact, but this is a real thing that among 1,000 people, if we calculate statistics who are using tobacco, 1 is dying due to homicide, 6 would be dying through traffic accidents, but 250 would die due to smoking or chewing tobacco related disease. So this is a very huge number that tobacco eating people are having death due to tobacco related diseases itself more than the routine natural deaths. So if the Indian population stops consuming tobacco in any form, 20% of deaths which are occurring in our country would be decreased. So what are the overall health hazards occurring due to tobacco? We all know tobacco goes either through the oral cavity, that is through the mouth, or we smoke it and it goes through into the lungs. So lungs are affected. Through the lungs, the tobacco goes into the blood vessels and affects the heart and multiple organs of the body. So starting from up to down, that is the top to bottom, we can see that mental health problems can also occur due to tobacco. Vision changes or loss, that is cataracts, are known to occur more in tobacco chewing or smoking people. Increased risk of heart attack because tobacco, what does tobacco do is it goes and makes the vessels means the blood vessels, the pipes which supply blood to the other organs, they become small. So the blood is not able to reach the organ which it has to reach because of the tobacco related effects. And that increases risk of heart attacks and heart disease. Apart from that, it also increases the gum disease risk because the nicotine goes and sits on the teeth and the gums. And the periodontitis is very commonly seen in tobacco chewers. Stroke risk, by stroke I mean there is a paralysis. In simple words, in the common man word, it is known as paralysis. Because the blood supply to the brain decreases, there is a high risk of stroke in tobacco chewers or smokers. There is also, obviously, we know it goes into the lungs, so lungs are irreversibly damaged due to tobacco. The tobacco also affects the pancreas, causing diabetes. Diabetes is also caused not only due to genetic factors or familial factors, it is also very commonly related to tobacco. Apart from that, females who you nowadays the trend or what we call people are thinking that tobacco smoking is very cool, and they are increasing the use of tobacco just to show their peers or friends that they are also very cool. These young females are having very high risk of infertility. Infertility means they are not able to reproduce children because their ovaries are hampered due to this tobacco. Apart from that, the bones become weak, causing osteoporosis at an earlier age. So tobacco chewers have very weak bones, and chances of getting them fractured or breaking them due to road traffic accidents is very common in tobacco chewers compared to normal people. Other than that, delayed wound healing. Delayed wound healing means after any surgery, if the patient, there are two, if we compare two patients, one is a tobacco chewer and other is not, and if we operate on both the patients, the person who is taking tobacco has a late recovery because the blood supply, the basic thing is blood supply everywhere in all these diseases. Tobacco causes shrinkage of the blood vessels, causing less amount of blood supply to whichever organ it goes through. This all effects are due to tobacco related shrinkage of blood vessels. So, not in India, tobacco smoking is not so common. Tobacco chewing is much more common than that. So, we are going to talk about both smoking and chewing. These are the two types in which in India tobacco is consumed. But apart from this, in other countries, apart in European or US, we can see that the tobacco can be used in these ways also. It can be sniffed, it can be snussed. There are small lozenges, that is tablets, or there are pellets. There are sticks, there are orbs. Orbs is like we have that tic tac kind of orbs, which you commonly use, like gems we have for small children. Similarly, orbs are available in the foreign market. These are all other ways in which tobacco is used in countries other than India, apart from chewing and smoking. Now, what chemicals are found in a tobacco or in a cigarette? You can see there are 250 known chemicals. By known, I mean there are other chemicals which we still do not know, and they're still harming the body in a tobacco smoke, of which around 70 are causing cancer, which include these. Some of the audience might be chemical engineers or related to chemistry. They know how harmful these chemicals are: acetaldehyde, aromatic amines, arsenic, benzene, beryllium, cadmium, chromium, ethylene oxide, formaldehyde, nickel. Now you can see the polonium 210. It is a radioactive element. We all know what a radioactive bomb did on Hiroshima and Nagasaki. Similar forms of radioactive traces are found in a tobacco cigarette. They are ingested in your body, and you think that I am smoking, so I am only getting the harmful effects. No, these chemicals, not only by passive smoking, you are harming your family members or your child, you are also giving them radioactivity and radioactivity related harmful effects to your family by ingesting tobacco through a cigarette. So, what are the effects? Like just now, I talked about passive smoking. Let us also talk in detail what passive smoking is. So, if you have a family member, a wife or child, or your mother and father in your family, and you say that I am smoking in my gallery, it doesn't matter you smoke in the gallery or you smoke in the basement, and you then come back to your house by eating some mint or some good fresh this uh, tablet just to prevent others from the smell. The smoke which is still there in your lungs, it is going to be exhaled from your lungs for at least 15 more minutes. So you are, although you are not smoking right now, that smoke is still there in your lungs, in your alveolus. That is going to come out, and that is going to affect your family members. And it is very common nowadays. Small children whose parents, whose father is a smoker, the child is 2 year old, and he is having severe kind of asthma for no fault of that child, just because his father is smoking, and that also, although he's smoking outside in the gallery or basement, still that child is suffering because of this reason. So I would request who have some family members or who themselves are smokers, please do not come to your house at least for 45 minutes to 1 hour after you smoke, to prevent your family from passive smoking. Now there is a famous, this is just a joke, there is a famous person called Jim Karke Fukne Wala. He's very wise thought that he is burning calories, not tobacco. So the person goes to a gym, he burns his calories, he comes out and he is taking an e-cigarette. This is, I'm focusing on topics which are latest, so I would talk about e-cigarettes. So he thinks that he's not being affected by tobacco, he's healthy, he's going to the gym, he has burnt his calories, and now he can easily burn e-cigarettes outside the gym at the small shop. But please let me tell you that e-cigarette, this is a screenshot from American Cancer Society, which we use as guidelines for our treatment. It says that the makers of e-cigarettes often claim that ingredients are safe, but it also contains some addictive nicotine, flavorings, and variety of other chemicals which are known to be toxic or to cause cancer. So the effects of these e-cigarettes are still not known and they are not to be considered safe. It is just e-cigarettes should only be used by those people who are already smoking cigarettes and want to downgrade themselves to a e-cigarette, and later on they help to stop smoking. So what is the role of e-cigarettes in a smoker? That basically e-cigarette contains nicotine. Nicotine and tobacco are the two important components of any cigarette. Tobacco is the one which causes the harmful effects. Nicotine is the one which causes the habit. So e-cigarette doesn't contain tobacco, but it contains very small amount of other chemicals along with a lot of nicotine. So this nicotine is addictive and it is also harmful. So if any person wants to use e-cigarettes, should be the only person who is already using normal cigarettes and want to downgrade. Just a normal kid, college going kid who thinks that e-cigarette is very cool and I can do it outside after going to the gym. No, it is harmful. It is going to cause harmful effects like cancer also. Now let us talk about what cancers can be caused by tobacco chewing or tobacco smoking. So mouth and throat, esophagus, voice box, that is the larynx, liver, lungs, leukemia, that is blood cancer, liver cancer, kidney cancer, stomach cancer, bladder cancer, pancreas cancer, uterus cancer, and intestine cancer. So you name an organ and I will tell it that smoking is causing cancer in that organ. So it is not just the oral cavity or it is not just the lungs which are affected by cancer through tobacco, but almost each and every organ in the body is affected by cancer due to tobacco. So how do we prevent? So prevention, as a medico, we divide prevention into two types, either primary prevention or secondary prevention. Primary prevention means removing the risk factor itself, that is saying no to tobacco. So those who have not yet smoked tobacco, they are pressurized by their peers that just एक बार smoke करके देख ले कैसा मस्त लगता है. Please do not go fall for it. Please say no to tobacco, because once you get addicted due to that nicotine and tobacco combination is going to blast in your body. So primary prevention is saying no to tobacco. Secondary prevention is if you are a tobacco chewer or smoker and you want to continue doing that. Okay, fine. You want to continue eating tobacco or smoking cigarettes. At least once in a year, you get your screening test done to prevent yourself from very aggressive form of cancers. What will this screening test do? That a doctor would check in your oral cavity, your lungs would be checked, and you would be detected in an early stage if at all you are affected by cancer. So secondary prevention is you would have a cancer already in your body, but you would be detected early by using this screening test. So primary is saying no to tobacco. Secondary is doing all this examination. So what do you check in all this examination is you remove, if you have any dentures in your oral cavity, you remove that. You look inside your lips, you see your tongue, you tilt your head back and see the palate or the roof of your mouth. You check all the buccal mucosa, the pink color structure which is there inside our mouth. You check everything from top to bottom. You feel for any lumps, that is, any swelling is there in your neck. You feel for any glands are there in your neck, in your jaw. So all this you do once in a month, every for 2 minutes in detail, in a bright light and a mirror in front of you. What to look for is very important. Now you are looking for, but what should be a red flag sign for cancer is either a red patch, either a white patch. These two patches are the first signs of cancer. If you have a white patch which is not going away, please consult a doctor immediately. If you have a red patch, it is a higher risk of cancer compared to a white patch. Go to a doctor and get it removed before it turns into cancer. Loose teeth. So normally a loose teeth would occur if anyone has hit you or if the person is very, very old, that would cause loose teeth. But if the patient is very, very young, he's a tobacco chewer and he's not hit by any friend or enemy, but he's having loose teeth, that means there is something below that teeth. Most commonly, it is some infection. I'm not frightening you, but there is a 15 to 20% chance that that loose teeth is not infection, it is cancer. So please get yourself checked. If you have a loose teeth which is not related to any trauma, like कुछ मार नहीं लगी है फिर भी loose teeth है in a young age in a tobacco chewer, get it checked. If you have a difficulty in swallowing, chewing or moving the mouth or tongue, this feature suggests that there is something which is obstructing the normal function of your mouth, which could easily be the cause could be cancer. If there are any swelling or lumps in the neck, that could be a second station of cancer. So how does a cancer, oral cancer spread? Is it goes from the oral cavity to the neck, and from the neck it goes throughout the body. So if there is a lump or swelling in the neck, that means there is something in the oral cavity, something in the nose, which could be a cancer which has come to the station number 2, that is the neck. And it is very less time is required to spread from station 2 throughout the whole body. So if there is any swelling in the neck, please consult a doctor immediately. Persistently, if you are having cough, persistently, if you are having hoarseness of voice, there is change of voice. Most probably it is due to asthma, most probably it is due to pollution, but there is still a chance that it could be in a tobacco chewer, there is a very high chance that it could be a starting of cancer. If you have a ear pain, if you have a jaw pain, if you have unexpected numbness or tingling, that could mean that there is a cancer in the jaw, which is causing the nerve to get fired, and that is causing numbness and tingling. Last and most important, if there is an ulcer, which is most commonly found, patients come to us, sir, there is an ulcer in my mouth, there is a jakham ho gaya muh ke andar, which is there since 1 month. I would request all my audience to please note that if there is a swelling in the mouth, if there is an ulcer in the mouth, which is more than 2 weeks, it means that there is a high chance it is cancer. In 2 weeks, if it is disappearing, it is chance that it is due to vitamin deficiency or other simple benign causes. But more than 15 days, it is a high chance it could be cancer. Get it tested. Now see this number. There are a lot of zeros. There are a few commas. So this is 13,50,000. These number of deaths are occurring in India each year due to tobacco. Please imagine if these people, if we stop consuming tobacco, these number of deaths and these number of people, this is just the death. Please imagine there is 10 times number of people who are taking treatment for cancer due to tobacco, treatment for heart disease due to tobacco, treatment for lung diseases due to tobacco. That is in hundreds of this number. So there are around 13 to 20 crore people of the population. We have an Indian population of around 130 to 140 CR. Out of that, around 20 CR people are either taking treatment for tobacco related heart diseases, lung disease or cancer, and out of that around 10% people are dying due to that. So if you people who are listening to me, most of would be educated and taxpayers, please imagine the money you are paying through your tax, the government is using that money for treating patients related to tobacco related diseases also, which is a huge number. So that could be reduced and that could be utilized in a better way if people who are using tobacco stop using tobacco, and that could be a very constructive use of the money which taxpayers are paying for the treatment of patients who are using tobacco in many hospitals. Same, if we break down, you can see there are around 4,000 people who are dying due to tobacco per day in India, 150 per hour, and 3 people are dying due to tobacco related diseases per minute. Now coming to the treatment option, this is almost my last slide of the presentation. It was a short and crisp presentation, I would suppose. I would like to discuss this in detail for you because I'm an oncosurgeon, and the treatment for oral cancers, especially related to tobacco, I would like to discuss. So there are 3 types of treatment for any cancer in the body. One is surgery, that is operation. One is radiation, that is some kind of X-rays are used to burn the cancer. And the third is chemotherapies, that is some kind of injections or medicines which are given through blood vessels are used to kill the cancer cells throughout the body. So these 3 treatment options are the options available for any cancer in the body. Now, specifically, if we want to talk about oral cancers, surgery and radiation are the most important treatment for oral cancers. There are 4 stages in any cancer. Just to simplify you, the next thing which I'm going to talk about treatment is has to be you should know the stages. And very commonly patients ask us, sir, what is the stage of my cancer? So briefly, I would like to say that there are 4 stages of cancer. Fourth stage is the stage in which the cancer is spread throughout the body, and there is very less options available for the treatment of that patient. Stage 1 is the best cancer one can get, if at all unfortunately one gets. In that stage, the cancer is very limited to that organ, very small, easy to treat. Stage 2 and 3 come in between, in which the other organs around that ulcer or around that lump are involved. Treatment is still possible, but there is a 50% 50-50 chance that the treatment would be successful, or the cancer would not ever come back again. There is only a 50-50 chance in that. So what are the treatment options? Is surgery for any oral cancer. For surgery, what we do in any cancer, not only oral cancer, if a surgery is utilized as a treatment option, whatever cancer is there in the body, the margins extra around that cancer has to be taken. By margins, I mean if the tumor is of size 2 by 2 by 2 centimeter in 3 dimensions, we will have to remove at least 3.5 by 3.5 by 3.5 in all dimensions. So just imagine if the cancer is in the tongue. The tongue itself, the length of the tongue is around 11 to 12 centimeter. The width of the tongue is around 4 to 5 centimeter, and the height of the tongue is around 2 to 3 centimeter. If there is a tumor of 2 by 2 by 2 centimeter, you tell me how much tongue would be left for the patient to talk, to swallow, to eat. So if there is a 2 by 2 centimeter, we are going to remove 3.5 by 3.5 by 3.5. Hardly any tongue is left if we want the treatment to be successful surgically. So early detection of cancer is very important. And if at all we remove that tongue, or if at all we remove the ulcer near the teeth, or we remove the bone which is present near the our jawline, we'll have to reconstruct it. That is, the plastic surgery is involved. The cost increases. Apart from that, the station 2, that is the neck, has to be addressed, and the nodes or the small lumps in the neck have to be removed after the primary is removed. Now the second part is radiation. If the tumor is so large that it cannot be removed, or it is so large that if we remove it, the patient will not be able to routinely do his routine activities, we advise the patient to get radiation, in which the tumor is not removed, but X-rays are used, high dose X-rays are used, or the other type of X-ray. To simplify, I'm just using the term X-ray, but there are beta rays, gamma rays, there are photons, there are protons, which are used to kill or burn the cancer cells. But now you imagine there is such amount of radiation which is going into the body. There is a normal tissue also around it. Although we are using very high-end technologies to prevent harm to the normal tissue around, but still there is going to be harm. And patients have to go through the side effects of this radiation. Apart from that, the third treatment option we have is chemotherapy. By chemotherapy, it means injections which are given throughout the body. And if there are small cells which have passed away, or they have surpassed the normal, the organ of origin, and gone through the other parts of the body like lungs or brain, this chemotherapy is going to take care of that. These are the three treatment options for oral cavity cancer. I focused more on oral cavity related to tobacco because first of all, I'm a cancer surgeon, and secondly, in India, smoking related lung cancers are there, but oral cavity cancer are much more. Hence, I focused on oral cavity. But I would like to briefly tell you about lung cancers also. So 80% of lung cancer usually present when the patient is very advanced, or patient has a very severe weight loss, or patient is not able to breathe, or patient is having blood in his sputum. Only then patients present, and that stage comes patient is out of multiple options of treatment, unfortunately, in lung cancer, because the lungs are very large, they are bilateral, so that even if the disease starts, it goes into such advanced stage, it comes centrally inside, and it affects the location such that only chemotherapy or only radiation options are usually left for the patient. Surgery is only possible in lung cancer patients for around 20 to 30% of cases only, because of these reasons. So I would request everybody to stay away from tobacco and its products. This is a slide which shows my website, sorry, my YouTube channel, which has other cancer related a lot of information. You can go through, you can put my name on the YouTube and you can get this channel. Thank you so much. This is my contact number, and if you have any doubt, you can right away ask me. If you feel shy or if you want to ask me later on, this is my contact number. I would be very happy to help you. Thank you so much. Thank you, Fraz.
Thank you so much, sir, for giving your valuable time and sharing your knowledge with us and making this session informative one, sir. I definitely think this session knowledge is going to help all the participants who have joined this session. Sir, I can see, sir, we have received some question from the participant end. If you allow, can I take this question with all your permission?
Sure.
Yeah, Dr. CV Rajmira is asking, in this part of country, most every third person is addicted to tobacco. Everyone know the risk, but not ready to leave. How to educate people by the medical process?
We have a lot of NGOs working for that, and we are associated with those NGOs to help the people, because tobacco in India, to be very frank, tobacco is a disease, uh, not only high class or upper middle class or middle class people. This is more commonly found in lower middle class or lower class economically. I'm talking economically. Lower class people, tobacco is found, and NGOs are going to places and taking camps. They are examining the patients. They are educating them. We are helping them through this online or directly personally. Also, we are going with them, and you can also do that and educate the people for that. Thank you.
Thank you so much, sir, for answering this question, sir. Moving forward, I can see another question from Dr. Madhuri Bhalgat, and she's asking, is smoking cause a ovarian cancer? What's your point of view on this?
Yes, ovarian cancer is also an important topic. We have not addressed that in this, but because there are other also multiple causes of ovarian cancer. But yes, tobacco smoking is related to ovarian cancer. Like we said, it also decreases the blood supply. It also causes infertility. Apart from that, ovarian cancer specifically, because there are three types of cancer in any gynecological part of the female. Uterus is there, ovaries is there, and cervix is there. There are three parts in which cancers are commonly seen, of which cigarette smoking is directly related to ovarian cancer.
Thank you so much, sir, for explaining it really well. I can see there is a couple of more questions, sir. We will be taking last two questions for today's session. And this question is from Dr. Agarwal. He is asking, what is the role of counseling in the treatment of nicotine addicted patients?
Yes, thank you, sir, for the question. Nicotine addicted patients should be sent for smoking help programs, which are there in our city and our hospital also. We do a lot of counseling. We start on them on some medications. We have awareness groups. We have help groups in which multiple people come, multiple patients come together, and they share their thoughts with each other, and it helps in improving their tolerance against nicotine. Thank you.
Thank you so much, sir, once again for explaining it really well. I can see last question from Dr. Subramaniam. He's asking, what are the mechanism of action for nicotine replacement therapy, that is NRT, to treat nicotine addiction and smoking in patients?
There are a lot of receptors like kappa receptors. We have antagonists against that. That is totally related to a psychologist or a psychiatrist department which take care of that. So I would not go into details of the pharmacology of that, but yes, there are a lot of medications available for nicotine addicted people and nicotine withdrawal symptoms also. Sorry, I could not answer that in detail because I'm not an expert on the pharmacological part of the nicotine mechanisms. I'm sorry.
Thank you so much, sir, for sharing your point of view on this question, sir. As I can see, there is no more question, but one feedback from Dr. Ashwarya Sincheria, and she has written wonderful presentation, and it was a good for knowledge. Thank you so much, sir, for sharing all your experience through this presentation. Sir, as there is no more questions, sir, with all your permission, shall we conclude this session?
Thank you so much, Farad.
Thank you so much, sir, and hope to see you again with different topic in coming times. Until then, take care of yourself. It was a great pleasure to have